Stephanie very nicely removed her heart for us from her rabbit. So just to start with this, because I think it'll actually be a little easier to orient just to the little heart first. What's this vessel you see coming out here that's blue? That's the pulmonary trunk, exactly. So what's it coming out of? What part of the heart?
Right ventricle.
Right ventricle, exactly. And then this would be left ventricle, and there's the aorta coming out of the left ventricle. So pulmonary trunk and aorta, left and right ventricles, that's what I always try to start with on a heart and orient myself in a ventral view. Okay. So this is the heart of the rabbit. Then this would be the same thing on the sheep, which is bigger and much fattier, but this is the left ventricle, right ventricle. There would be the interventricular septum. We follow the right ventricle up. This is the pulmonary trunk coming out here. And then what would this be coming out behind pulmonary trunk?
Aorta.
Aorta, exactly. And you can actually see there's two vessels here where they've cut this off very short. I don't really know why they do that. But this is the brachiocephalic artery or trunk coming off, and this is the actual aorta. And that's why you see two vessels right there. So that's kind of a nice thing to orient to on the sheep heart, is just where there's two, that's got to be the aorta. Two things connected. So this is, again, a ventral view. The heart sits in the chest kind of like this. And this point of the heart is called what?
Apex.
The apex. And then this would be the base. So if you think about a triangle has an apex, which is the point, and then the base. And that seems always strange to me that the apex is pointing down, or caudally, but it does. We've seen right and left ventricles. This would be what then? Atrium. So this is the left atrium, right atrium. These sheep hearts are really fatty. I've tried to pull off a lot of fat. There's still lots of fat left, but we can at least see some things. Pulmonary trunk, arch of the aorta. Did you see the ligamentum arteriosum on here? Probably not. One of the things on our list is the ligamentum arteriosum, which is the connection between the pulmonary trunk and the aorta. And don't see it there. I wonder if we can see it on this cat. Sometimes you can actually see it. It's not really dissected enough, I think, on this cat either. But if you see something that's basically running between a strand of connective tissue running between the pulmonary trunk and the aorta, which would in this heart be just a little bit further up than where we're cut, so basically right in there, that's the ligamentum arteriosum, and it's the remnant of the ductus arteriosus, which is that fetal connection between pulmonary trunk and aorta. Okay, so this basically have done heart chambers, the two major outflow vessels. Then we have to worry about things going back into the heart. And since this is the right atrium, what vessels carry blood back to the right atrium? The vena cava, exactly. And there's a cranial vena cava here, and a caudal vena cava down here. And it doesn't really show up very distinctively on the sheep heart. It's just kind of cut off. You can see it very beautifully, though, on this rabbit heart. We flip it around and look on the dorsal side. There's the left cranial vena cava and the caudal vena cava. You can also see, did I say left? Sorry, right cranial vena cava and the caudal vena cava. And you can also see the left cranial vena cava coming down and then crossing over to drain also into the right atrium. Right cranial vena cava, left cranial vena cava, which joins in, and then that's the caudal vena cava. Yeah. So, it's very nice. Okay, it mentions here this thing called a coronary sinus, and if we look at the rabbit heart, we see how the left cranial vena cava comes down and crosses over to join in to the caudal vena cava and right cranial vena cava and dump into the right atrium. In the cat, there's that shunt up higher, and so we don't have a left cranial vena cava, but there is a little connection in this vicinity. And it's basically just draining the blood from the heart muscle itself, and that's called the coronary sinus. And so we're on the back side of the heart, basically looking in this region between the atria and ventricles. And so if we look here at this heart, get oriented for a second. This is the ventral view, so this is the front, I like to call it, of the heart, what you're used to seeing, pulmonary trunk and aorta. If we flip this over again, on the back side of the heart, here are the ventricles, here are the atria, and right in this region here, if we get a probe into it, you can actually see a little chamber where that probe is. You see that? Where I'm kind of wiggling it? That's the coronary sinus. And that's draining the blood from the heart muscle back into the right atrium. And there is a whole coronary circulation. There's coronary arteries that bring blood to the heart muscle and coronary veins that drain the blood from the heart muscle back to the right atrium. The heart muscle can't get enough blood, enough oxygen just from the blood sitting in the heart itself. All right. So that's all the things that come into the right atrium. This is the vena cava, and then in the cat, it doesn't have the left cranial vena cava, the coronary sinus. Pulmonary veins go into the left atrium. And again, to orient, this is the left atrium. So if we flip around on the back side, what you'll typically see in these sheep hearts is just this kind of big hole there where all the pulmonary veins have been cut off. And that's where they entered into the left atrium. Let's see what your rabbit heart looks like. It might be better. Yeah, a little bit. On the rabbit heart here, there's some dried blood right here, and pull the dried blood out. Attached. Just there we go. Okay. And you can see the same thing here on the back side of the heart, the dorsal side. There's where the pulmonary veins came into the left atrium. So, okay. So, again, hearts can be very hard to orient to. Whenever you get a heart, make sure you first figure out what's ventral, what's dorsal, where's pulmonary trunk, aorta. Get that basic orientation before you start trying to put names on things. Okay. If you were looking at a dorsal view, it's going to look pretty different from a ventral view. Okay. As long as we're here with the heart, let's take a look at some of the internal structures of the heart, and we can go do the rest of the vessels that we didn't do last time. So, internal structure, right, cranial vena cava, caudal vena cava, etc. We've basically got all the vessels that are going to bring blood back into the right atrium here. So this is blood that's coming from where? What vessels go into the right atrium? We just did. Right. Vena cava, exactly. So left and right cranial vena cava, if there's a left, and caudal vena cava. Where's that blood coming from? The body. So is that oxygenated or deoxygenated?
Deoxygenated.
Okay, just checking. So that's going to come into the right atrium, and this is the right atrium I've opened up there so you can see inside what it looks like. And coronary sinus, that I just mentioned, draining blood from the heart muscle itself, it enters the right atrium right there. You can see where the probe is. It's going into the opening of the coronary sinus. Can you see that? Yeah? Do you guys see that? No?
No.
Oh, okay. Yeah, say no if you don't see it. We'll try to open it up a little bit more for you. Right there. Coronary sinus opening.
Oh, okay.
Yeah? That was better. All right. Okay. So that's all the blood that flows back in the right atrium. And then the blood from the right atrium is going to go where? Right ventricle, exactly. So it's going to pass down into the right ventricle. And I'm sticking the probe now through down into the right ventricle from the right atrium. Okay. And the blood going from the right ventricle to the right, and from the right atrium to the right ventricle passes through a valve that prevents backflow into the right atrium. And you can see if you look in, a little bit better job doing that, just so I can open it up wider. You see this valve right there, coming from it's basically this structure here. This structure right here is the valve. And what you'll see is this valve is called the tricuspid valve, or the right atrioventricular valve is the other name for it. It's tricuspid because it has 3 flaps, and these flaps are held by little strings of heart muscle there, and those strings are called chordae tendineae, which means tendinous cords. Okay, you see those guys? And there's 3 flaps, which is why it's called a tricuspid valve, because there's 3 flaps, or right atrioventricular valve. So the blood comes down into the right ventricle here, and then the right ventricle is going to contract and send that blood out of the heart by way of what vessel?
Pulmonary.
Pulmonary trunk. And so there's the pulmonary trunk. Kind of dripping, out the pulmonary trunk. And there's a valve at the base of the pulmonary trunk that prevents blood from flowing back into the right ventricle. So you see this little flap, there's 3 of these, and these are, each of them looks like a half moon, and so this is called the pulmonary semilunar valve, because each of the flaps looks like a little half moon. Do you guys see that there? That's one of the flaps I'm kind of pulling out here, the base of the pulmonary trunk. And there's another one here, for example. And the blood just kind of fills up that pocket, closes them. And so that prevents backflow. So the blood goes out pulmonary trunk to the lungs. What happens in the lungs?
Oxygenate.
It's oxygenated, and then it's going to come back to the heart by way of what? Pulmonary veins. Okay. Towards the heart, it's going to always be a vein. Okay. Pulmonary veins into the left atrium. And again, the pulmonary veins really get cut off, so you can't see them too well, but I've opened up the left atrium here, and you can at least look down and see the valve opening from the left atrium into the left ventricle. That's the bicuspid valve, or left atrioventricular valve.
Why would this one require only 2 valves while the other required 3?
It's just how it is. I don't know.
Is there more blood flow coming in because there's so many vessels dumping into the right
Well,
atrium?
the amount of blood on the left side of the heart and the right side of the heart is exactly the same. If you think about it, the blood that leaves and goes to the lungs and comes back to the heart has to be equal to the blood that leaves and goes to the body and comes back to the heart, or there would be an imbalance. So it's exactly the same volume of blood. There's more force on the left side of the heart because it has to create a greater pressure and send it out to the entire body. But in terms of the actual volume, it's the same. I don't really know of a good explanation for why there's only 2 versus 3. Anyway, that's the whole it's from atrium down to ventricle. And then I've also opened up the left ventricle so we can look in there. And again, you can see the chordae tendineae running up to the valve flaps. And I'm not sure I mentioned them on the other side, but you'll see more easily here these kind of little swellings of the heart muscle on the side wall of the ventricle. And those are called the papillary muscles.
Can I see him again?
Yeah, these things right here. Okay. The other thing I wanted to point out is if we open up the 2 ventricles, notice how much thicker the wall of the left ventricle is than the wall of the right ventricle. Yeah, why do you think that is?
More pressure.
More pressure, yeah, more force, exactly. Okay. So then blood's in the left ventricle, and where's it going to go? To the aorta, and I can stick a probe here from the left ventricle, and it's going to pop out here, out the aorta. And at the base of the aorta, there's another semilunar valve. I haven't opened it up, so we're not going to get a good view of it, but that's called the aortic semilunar valve. So there's basically 4 valves to be concerned about. There's the left and right atrioventricular valves between the atria and the ventricles, and there's the pulmonary and aortic semilunar valve at the base of the aorta and the pulmonary trunk. All right, what am I doing? Oh, okay. I did not mention the interventricular septum, but you can kind of imagine what it is if you just put one finger in the left ventricle and one in the right and feel that wall between them. That's the interventricular septum. And what makes a mammal heart different from a turtle heart or a frog heart or a nectar's heart is that they have a complete interventricular septum. There is no opening between the left and the right sides of the heart, and that's how you have a completely separate pulmonary and systemic circulation in a mammal, which is not true for other animals that we dealt with anyway. Birds have the same thing. Birds also have a complete interventricular septum. Likewise, there's an interatrial septum between the 2 atria. And that, again, is most easily found if you just kind of stick your fingers in one atrium and in the other atrium and feel that partition between them. That's the interatrial septum. That is present in turtles and frogs and very poorly developed in nectarines. And the last thing I'll just mention is in the interatrial septum, you can see a little oval area that's kind of shallow and thin. Do you see that oval or area there? Yeah? Okay, do you guys see that? Okay, this is called the fossa ovalis. And the fossa ovalis is just a very thin area in the interatrial septum that's a remnant of a fetal opening. In the fetus, there's basically 2 shunts that get blood towards the systemic circulation away from the lungs. One is the ductus arteriosus between the pulmonary trunk and the aorta, and the other is this foramen ovale between the right and left atrium. And so in the fetus, blood that comes back to the heart into the right atrium, rather than all getting sent to the lungs, can go across to the left atrium directly through that hole, and then just go down to the left ventricle and out to the body, because there's not a lot of point in sending half of your blood with every heartbeat to the lungs when you're not breathing. So there is a little bit of blood flow, but most of the blood gets shunted away from the lungs towards the body in the fetus. I believe that's it for all the internal heart structures. Is that good? All right. This sheep heart is much more attractive than it used to be anyway.